cannot really completely cure any disease, but we can always help the patients to reach their maximum functioning level. So all kinds of clinical populations you can think, children with developmental disorder, with autism or learning disability, Down syndromes, those kind of things. So we can really use music to enhance their learning and development. Also, people with mental disorders, psychological problems, and schizophrenia, depression. So we use music for them to really open about themselves and also have more reality-based intervention.
2 years ago or so, I worked with Gabrielle Giffords to help her with speaking, communication through music, and also her movement, her body movement as well, walking and moving her arms through music techniques. So I worked with her for about an hour and a half every day, 30 minutes by myself alone, and 30 minutes in a co-treatment with either speech therapy or physical therapy, and then maybe another 30 minutes or so in a group setting.
And what kind of exercise do you do in such a case?
Okay, so for example, first to get sound, to get her to talk or any kind of sound, I use something called music speech stimulation. So it looks like I'm just singing a song with her, something very familiar, to retrieve words. So that's music speech stimulation. And then I wanted to teach her, as she got more words, how to speak phrases, sentences.
There are a couple techniques. One is using rhythm. So like you lost how to walk because of stroke. So their maybe walk is very slow and very unbalanced. But if they hear very steady beat, boom, 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 our body, our brain want to synchronize, bum, 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 bum. So if you listen and then practice the walk, then your gait, your walk gonna be more balanced, and then maybe if you speed up your music, then maybe your walk and gait gonna be speed up, those kind of things. Also, you lost how to speak. Then, but we can always say little star or show the picture of a star. They might not gonna speak the star right away, but there is a song, Twinkle Twinkle Little. Patients want to complete that with star.
We can see that the melody and the rhythm are working to help produce speech. There's only been a little bit of research done on that, and it was a long time ago. And speech therapy, like I said before, it's kind of their technique, so they have more of the research behind it. So music therapy needs to do their own research in it. So we want to add to the field, giving it more validity.
Does it lack validity today?
I think a little bit it might. Where Amy and I work, they believe us there, but outside of the hospital, sometimes it's harder to prove to other people.